and very gold.
Hi guys, this is Dr. Apostol. So we're here in my third vlog for this year. And I'm so excited to share this case with you all. This patient went to my clinic with a chief complaint of discoloration, a lot actually. Number one, discoloration. Number two, space, gaps, chipping of incisors, and peg lateral. So he's actually on his 50s. He's actually based abroad. American. I am excited to really share the after right away, but I'm gonna walk you through the process of this treatment. So number one, we need to, of course, pag pupunta dito, whenever you're here, or the first meeting should be proper assessment. In proper assessment, we have to make sure that we see all problems. Number one, the health. Is the health questionable? Not just the teeth, but also systemically with regards to the overall health of the patient. And then after that, we check on the mouth, the teeth itself. We check the soft tissue, we check the teeth itself. So we do a clinical assessment. But we don't forget also yung photography, and then we scan the teeth to check the position of everything, also to assess it outside the mouth. After finishing all the first step, come the making of the treatment plan, the treatment planning, plus the smile designing. It's very important to note that when we create a smile design, it should be in harmony to the face. That's the reason why we have a dentofacial analysis, because sometimes for some patient, longer central incisors would be beneficial to the whole structure of the face, but for some hindi. So we have, a plethora of designs, but I decide what's best for the patient. So I actually discuss it with the patient, what's the best size for him. So I also ask the patient, ano ba yung request? Ano ba yung ini-envision niya for his smile? He really desires to have wonderful, bright, white teeth. So, of course, we created something for the patient actually to make it look brighter. Para it would really complement the whole face. But first things first, we have to make sure that we treat whatever problems. Problems such as chipping. These are signs that there's, signs of aging. You're really using that particular teeth, especially in the front, na nagkaroon ng chipping. But it's really part. That is normal. Pero dito sa case na to, it's fairly straightforward. There's a discoloration of the teeth. It's tetracycline stain na, according to him, he was suffering from that color. We also need to make sure that the functionality and the health should be established. Okay, so there's a systematic approach, In order for you to go to beautiful teeth, you have to make sure that it's healthy. You have to establish the function. Tapos, icing on the cake, boom, here's cosmetic. So, hindi tayo nagpo-focus more on the cosmetic part, but we have to make sure that it should be, the most important why we have teeth, which is function. Function, health, and beauty, because it's a cosmetic procedure. Okay, so the process is pretty straightforward under local anesthesia. Under local anesthesia means nag-anesthetize kami, we numb the area on the upper and the lower, to make sure that whenever we remove all the unsound structure or we prepare the teeth, we make sure that there is no pain. That's why for a veneer preparation, it should be painless. But that doesn't mean wala anesthesia. You have to make sure that we put in some anesthesia just to make sure that wala talagang pain, or it should be traumatic. It should be painless. It should be comfortable. So what I did kasi dito medyo discolored. So I actually extended the margin under the gums, like about 0.5 millimeter, because we want to conceal that area, but not too much. Not too much. I mean, there's always the biologic width that we need to respect. There's also the gums that is healthy that we need to protect. So it's not about having perfect sets of teeth, but we have to make sure that it's healthy, because there are a lot of veneers or crowns that has gum problem because they impinge that without realizing the biologic width must be respected, must be considered. So we really need to make sure, no, in all cases, we have to assess. That's why assessment is always the key in order for us to get that healthy and beautiful smile. Here in my practice, it's about a week. It really depends on the case. For some, it can go 2 weeks or 3 weeks. It really depends, because if there's any problem, we're talking about the health of the teeth, we're talking about the complexity of the case, then it requires more time for us to complete the whole thing. So there is no one template na pag 1 after 3 days, after 5 days, after... No, it's always case-to-case basis. So, yung translucency medyo binawasan natin. We decrease the translucency instead of the high translucent, the usual thing that we do. So, I use Zirconia for the core, okay? And then, we layer it with high fusing porcelain to make sure that it would look natural. So, since the patient requested for a whiter shade, so, nagkakaroon ng ano yan, sa shade tayo nagkakatalo. Pero, the goal is to conceal the discoloration na hindi siya magmumukhang fake, pero it's kinda white. So, the opacity of the zirconia and the translucency of the porcelain, we combined it para to create that what patient desired. It's very important to do a try-in, especially for ceramics, because this one is kind of complex that we need to make sure na babagay siya sa pasyente. And also the fit. We have to check the fit. Kamusta ba yung fit niya? Because if there's something wrong with the fit, then there will be problems in the future. Okay, so fit is very important to check. That's number 1. Number 2, the design. Saan na ba siya? Maayos ba? Patient requested for a whiter smile. Of course, we asked the patient, are you okay? Do you love this color that you requested? After the try-in, masaya na yung pasyente. He was actually ecstatic about the result. He loved it. That's the thing. Sometimes our eyes doesn't really like the white idea. Gusto natin natural, but it's the beauty, the color, it's always subjective. For some patient, they want on paper white. For some, yellowish. For some, white enough. For some, bagay lang. But may binabagayan eh. So every individual has a specific notion of what beauty is. So it's always subjective. It's unique. People are unique, so as the design should be unique. He was happy about the result. Try-in pa lang. Of course, before we cement it, dapat happy yung patient. Pero wala na tong ano eh. I mean, we try it in, fits perfect, wala nang problema. We treated the teeth, the ceramics, we placed it, we bonded it, and that's it. follow-up is very important because sometimes when we do our smile makeover, kasi marami yan eh, may mga excess pa yan na matitira. There will be something with adjustment with the bite. So we run it with T-scan, we do a normal equilibration thing, we check the bite, and that's very important. We give the patient night guard. Night guard is essential in such a way that it protects the teeth whenever you sleep, because your teeth will send a signal to your brain that there's something wrong. Iba na yung sets of teeth natin. So your teeth will, grind unconsciously because there's something wrong. So the purpose of the night guard is to protect until masasana yan. So that's very important. So after follow-up, after a few days, maayos na, fit, walang problema. For some cases, may mga questions sila, Doc, why is it so hard to adapt and adjust? For some cases, Doc, it feels like natural, walang nangyari. But sometimes, it really depends on the design. Kasi once we add volume, once we add length, once we change the symmetry, of course, 100%, it will take time. You have to take time to adapt. You have to take time to adjust. How many weeks? Some weeks, some months. So during that adaptation phase, you really have to be patient. Okay? Restoration is really good because we restore the tooth to become better. We restore it to make sure that it would remove all the imperfection. But not just that, we enhance the appearance in order to complement the face. So that's actually the beauty of cosmetic dentistry that we provide here at Apostol Dental. So I'm happy for the patient that he got his wish, and I'm ecstatic also that for his future plans na magpa-perform siya on stage kasi yun yung trabaho niya. So I'm so happy sa result. Yeah, so I think this would be the end of my vlog, and I'll see you again on my next vlog.